I'm now happy to introduce Dr. Joanna Ilska. Dr. Ilska works as Genetics Research Manager at the Kennel Club. She joined the Kennel Club in 2021 after more than a decade of research in quantitative genetics at the Roslin Institute at the University of Edinburgh, Scotland. Her main scientific interests revolve around genomic prediction of breeding values in complex traits across a range of species. In particular, she examined usage of large data sets using various sources of genomic information, with the largest data set including whole genome sequence variants in over 200,000 individuals. Aside from her work on the genomic predictions, Dr. Ilska has always been keenly interested in dogs, from competing in dog sports, obedience trials, to collaborating in a few extracurricular scientific projects on genetics of dog health and behavior. Now, throughout today's Canine Health Summit, we have seen some great questions and dialogue in the chat, so please keep that going. You can post questions and comments during Dr. Ilska's presentation, and she will answer as many as she can afterwards during the live Q&A portion. Please join me in welcoming Dr. Ilska.
Welcome, everyone. My name is Joanna Ilska, and I work as the Genetics Research Manager at the Kennel Club in the United Kingdom. I've joined the Kennel Club just over a year ago after working as a researcher at the Roslin Institute at the University of Edinburgh in Scotland. I specialize in the development of breeding tools for complex traits, and this is what I'm going to talk to you about today. I'm very grateful to Embark for this invitation because I feel quite passionate about the complex traits. There is a lot of misconception about breeding for complex traits. And although, of course, breeding for such traits is more difficult than breeding against monogenic traits where we can use DNA testing, it is possible. I section my talk into three parts. First, we are going to go through the basics of the complex traits. We are going to discuss what is it that makes them so tricky, and we'll get some definitions, some basic definitions covered so that we talk using the same language. Next, we're going to talk about EBVs, or estimated breeding values, a tool that has been universally accepted as a selection tool in complex traits in both livestock and crops. Finally, we're going to look at how EBVs can be used for selection against complex diseases in dogs, using the example of canine hip dysplasia. Over the last 2 or 3 decades, we have seen an explosion in research and public focus on monogenic traits. And thanks to this, we have made great progress, significantly reducing frequencies of mutations causing many, many diseases. Unfortunately, a majority of the traits that we observe in the natural world are actually complex. Complex traits are determined by thousands of genetic variants, and many of them are placed in regulatory regions outside of genes, which makes them really quite difficult to first identify and then properly assess. To make things more complicated, they are also frequently affected by the environment. So just to make sure we are all using the same definitions, let's refresh some basics. I'm going to be talking a lot about the genotypes and phenotypes in today's talk. A genotype is a pair of the variants of a gene that an individual carries, that the individual inherited from its parents. We can also use this term to describe all the pairs across many genes that an individual has. So if we talk about, for example, coat color, the black and chocolate coat color in Labradors, we have 2 variants, a capital B codes for black and a small b codes for chocolate. The genotype would be either 2 capital Bs, a capital and small b, or 2 small b's. Phenotype, on the other hand, is something that we observe. It can be coat color, it could be whether the dog is suffering from a disease, it could be dog's height, and many, many others. So let's start from the genotypes. When we talk about a trait that is affected by one gene and there are only 2 possible variants, the situation is very simple. There are 3 possible genotypes, and if we know the genotypes of the parents, we can easily predict the possible genotypes in the offspring. Unfortunately, as the number of genes that impact a trait increases, so does the number of possible genotypes. If a trait is determined by only 3 genes, the number of possible distinct genotypes is already 27. By the time we get to a trait that is determined by 10 genes, we are talking about tens of thousands of possible distinct genotypes. This means that very quickly we are no longer able to predict the genotypes in the offspring using pen and paper. We need to use more and more sophisticated calculators. Now, let's think about what the genotype actually tells us about the phenotype. Again, for monogenic traits, the situation is simple. In most cases, the genetic variants are fully responsible for the trait, and so the genotype tells us exactly whether a dog is going to express the trait. Most of the monogenic diseases are recessive, which of course means that we can have two possible phenotypes. We either have a dog that is free from the condition but genetically could be a normal or a carrier, and then we have a homozygous recessive individual that will be affected with the disease. For most complex traits, unfortunately, the effects of each gene are very, very small, but together they add to a total genetic value of that individual. This gives us a pretty complex outcome, as there are multiple possible genotypes which could produce the same phenotype. Let's assume that a trait is determined by 3 genes. Each of them has 2 possible variants, a capital letter and a small letter, and that each variant marked with the capital letter is going to add 1 unit to our trait. If we breed 2 dogs which are heterozygous for all 3 genes, so they have a capital and a small letter for each of those genes, we will have 64 possible outcomes, anywhere in between a genotype where all variants are adding to the trait, so all are capital letters, to the one where none of the variants add to the trait, so all the variants are small letters. The table on the right shows those possible combinations with the numbers indicating how many capital letters a particular genotype would have. You will notice that the number 3 is the most common. In fact, as many as 20 different genotypes result in the same effect of adding 3 units. There is an equal number of genotypes that add either 2 or 4 units, and that number is 15. Then there are 6 different genotypes which give an effect of +1 or +5. And finally, there is only 1 genotype that adds 6 units, and only 1 genotype which would add nothing. So as you will note, the distribution of those possible effects is symmetrical, with the highest number of genotypes giving us intermediate values, and the lowest giving us the most extreme values. We call this distribution normal or Gaussian. The great news is that this type of distribution is very common in all walks of life, and so it has been very well studied by statisticians. But because of the challenges in determining genotypes and individual genes and the additive nature of those variants, we don't necessarily want to memorize the individual genotypes a dog carries. Instead, we want to assess the overall genetic merit of the individual, and especially we want to see how he places within the distribution among other dogs in his breed. The good news is that we have statistical methods which can estimate this overall genetic merit of a dog, even if we have no knowledge about the specific genotypes. We will come back to this in a moment, but for now, let's switch gears a little bit and let's talk about the environment. We know that most of the complex traits are affected to some degree by the environment. The phenotype that we observe is a sum of both the genetic predisposition and the environment that this individual has experienced from very early on in his development. So when we think about the variation in that trait in a breed population, environment will affect what we see. How this happens exactly depends on the trait and the environment itself, of course. For example, in this plot, we see that the environment pushed some of our genetically moderate dogs either way. Some of them became better, and some of them became worse than the genetics alone would dictate. Now, the big question, of course, is how important is the environment and how important is genetic predisposition? Well, we can measure it with a parameter called heritability. It tells us how much of the variation we observe in a trait in a population comes from genetics and how much comes from the environment. If heritability is 0%, then there is no measurable genetic variation, and all that we see is dictated by environment. If, on the other hand, the heritability is 100%, then environment has no effect and all variation is due to genetics. An important point to remember is that heritability measures variation in the trait in a population. It isn't necessarily transferable between populations, and it doesn't apply to a single record of an individual. So, for example, we could measure some traits first in twins. They are genetically identical, so any variation between them will be due to environment, and so the heritability will be 0. On the other hand, we could measure the exact same trait between two genetically distant individuals in the exact same environment. In this case, all variation would be due to genetics, and so the heritability would be 100%. So we know that complex traits are determined by thousands of genes with possibly millions of genotypes, all of which have only small effects that add together. We know that environment can significantly impact on the phenotype, but not all is lost. Selection for or against complex traits is very much possible. The earliest success story of selection for complex traits is actually the domestication, and in no species it is clearer than in dogs. We have selected for size, temperament, drives, head shape, body proportions. All of those traits are complex. But of course, nowadays we would like to speed up the process a little bit. Over millennia, all selection for complex traits has been based on the phenotype of our selection candidates. So we would measure the trait of a stud dog and decide whether we were going to use him or not based on how good he was for that specific trait. And that method or phenotypic selection sometimes worked fine, but unfortunately in a number of traits the progress with phenotypic selection can be extremely slow. First, it is slow for traits with low heritability because the differences between our selection candidates are driven more by the environment than by genetics. We also know that progress generally tends to be slow when traits are measured late in life. An extreme example of this would be breeding for longevity. You can't really assess it until your dog passes away. Similarly, progress is slow if we can only select on one sex. A good example for that would be traits related to maternal behavior. We can't measure that on sires. But not all is lost. We've known that we can do better than this for decades. And this is where we are moving into our estimated breeding values. Before we actually discuss the statistics behind EBVs, let's first talk about relatives. If we think about it, if there is any sort of genetic influence on a trait, then there will be some sort of resemblance between relatives. The closer the relatives, the more alike they are going to be, as they share more of their genes with each other. This similarity of relatives can be used to hone in on the bits of the variation in a population that are actually due to genetics. And of course, assessing not only the dog, but the whole family is something that any good breeder does all the time. Let's say we have two dogs. Both are exceptional in conformation and work. In fact, they seem to be the best dogs that ever lived. But they also have mild dysplasia. They are also the only two options that you have. So which one of those dogs would you use in your breeding program? Well, the best option, of course, in this case is to look further in the pedigrees of those dogs. So we know that both of them have mild hip dysplasia, but the pedigree of Rover is filled with dogs with mild and even severe dysplasia. On the other hand, Fido has generations of dogs with excellent hips behind them. So let me ask again, which of those dogs would you choose? EBVs, or estimated breeding values, are a statistical tool that does exactly the same thing, only on a much, much larger scale. When EBVs are calculated, we take a complete pedigree and all of the available measurements for that trait. We plug them into a statistical model which does several things. First of all, it measures how much variation there is across the whole pedigree. Then it finds out how much of that variation can be explained by the resemblance between relatives. Finally, it uses this information to estimate the genetic merit of the dog. We can imagine this as the phenotype of the dog being stripped of the effects of the environment. And the statistical model produces the EBVs for all the dogs in the pedigree. EBVs are expressed in relation to a breed mean. For an easier interpretation, mean is usually scaled so that it is 0. Depending on the trait, we might want the EBVs to be higher than the mean or higher than 0, so they will have a positive sign. For other traits, we actually may want the EBV to be lower, so that it will have a negative sign. When we talk about using EBVs in selection, our approach is slightly different to selection against monogenic diseases. As we've said, we are not searching for a dog that has the best of the best genotypes for each of the individual genes. Instead, we use EBVs to rank individuals and then select the ones that are better than the average of the breed. We are aiming towards gradual shift of the distribution of the HIT scores across generations. One point that we need to remember is that EBVs predict the genetic merit of an individual. Of course, we generally expect that dogs with good genetic predisposition should also have good genotypes, but that depends to a certain degree on the environment. So we could have a dog with good EBV that experienced poor environment, and so his phenotype is not so great. We could have a dog with poor EBV who has a great phenotype because he was kept in exceptional conditions. However, the dog with a good EBV will produce offspring with better genetics than the dog with poor EBV, as it is the genes and not the environment that are being passed on. A very important parameter that we need to discuss when talking about EBVs is their accuracy. As I have said before, the statistical model that produces EBVs produces them for all the dogs in the pedigree. But obviously, not all dogs will have the same amount of information coming in from their relatives. So the more information we have, the more accurate or the closer to the true breeding value of the dog our EBV is going to be. If there is no information available, the accuracy of the EBV we are estimating is going to be 0. And this is the same if we think about phenotypic selection. If you don't have a score on your dog, if the parents don't have any scores and none of the relatives have any scores, you have no idea what these dogs actually have. As we start adding more information, our accuracy will grow. Of course, we want to reach a point where our EBVs will tell us more about the genetic merit of a dog than looking at the dog's own score. In those situations, when we have an accurate EBV, we may choose a dog who perhaps has a slightly less than ideal phenotype, because we trust that the EBV tells us that his poor score is actually due to environment. So because EBVs are estimates, they are usually given together with what we call confidence intervals. We say that we are 95% sure that the true genetic merit of the dog falls within the confidence interval on an EBV. And accuracy determines how precise this interval is. For example, with a low accuracy shown on top here, our confidence interval says that the true genetic merit is somewhere between -65 and +45. Obviously, that isn't very informative, as the dog could be both better and worse than the breed mean, and by quite a margin. So this EBV really isn't informative. On the other hand, with high accuracy presented on the bottom bar, the confidence interval is very, very precise. We are pretty sure that the true genetic merit of the dog is somewhere in between, let's say, -33 and -40. So adding a few new scores from this dog's offspring might change the EBV from, let's say, -37 to -38. But it's not going to change the fact that this dog has an EBV that is consistently considerably below the breed mean. Of course, we want our accuracy to be as high as possible, but as long as it is higher than a square root of the heritability for a trait, we know that we are doing better than we could with a simple phenotypic selection. So how do we improve our accuracy? Well, as you may have guessed, we need more data. The dog's own phenotype, the phenotypes of his parents, his offspring, all provide very, very useful information. But of course, that means that we need to keep testing. So you may ask, is it all really worth it? Well, it is. First and foremost, EBVs provide an opportunity for a much more precise selection. The more precise we are in identifying the genetics behind complex traits, the quicker we can change them. EBVs are so useful that for decades now they have been the staple in all breeding programs in livestock and crops. EBVs made possible massive improvement across a range of species and traits, from production traits such as milk per cow in dairy cattle and growth rates in chickens, to fertility and fitness traits such as litter size and mortality in pigs. So selection for complex traits in all species outside of companion animals is done only with the use of statistical models which produce EBVs. Another benefit of EBVs is that they are produced for all dogs in the pedigree, whether they have phenotype or not. This is particularly useful for traits which physically can be measured in some individuals, as we've said before, so late in life traits or sex-limited traits. But it can be also useful in other circumstances. So, for example, we could get our hands on frozen semen from a dog who lived 50 years ago, and he wasn't tested for the trait that we are interested in. But he has produced a number of offspring, and some of his offspring has been tested for that particular trait. So the information from his offspring will feed into his EBV, and we could gain information necessary to make that decision whether we want to use that semen or not. Another benefit to EBVs is that they help us examine whether our breeding programs are actually working. Of course, we should all strive to keep our dogs in the best environment possible, but the environment is not passed through the generations, the genes are. As breeders, we should be constantly evaluating the genetic trends, as genetic improvement is the only way to bring a permanent change in a breed. So let's say we see a decline in the prevalence of a particular condition. If we look at phenotypes alone, we don't know whether this is due to selection or the environment. Having EBVs, we can actually examine the genetic trends and how they compare to the changes in the phenotype. So, for example, we could note that although phenotype is affected by the environment, the progress we are seeing is actually completely driven by genetics, as we see in the first plot. Or we could see that there is an improvement in genetics, but there is also some improvement that genetic improvement doesn't account for. That shows us that the environment has improved as in the second plot. Finally, we could see that actually, even though the phenotypes are improving, there is no change in the genetic trend. That means that we have made super progress with the environment, but actually, genetically, the dogs are as bad as they were 10 or 12 years ago. So let's finally talk about a practical example. I'm sure that most of you are familiar with hip dysplasia. Some of you, including me, probably far more familiar with it than you would want to be. In brief, hip dysplasia is a complex developmental condition where the malformation and laxity of the hip joints leads to abnormal movement within the joint, and as a consequence to irreversible degenerative joint disease. Sadly, we have been fighting with hip dysplasia for more than 50 years now, and yet the prevalence of this condition in some breeds is still very, very high. Typically, it affects large and giant dogs, but it can be also found in smaller, especially stocky breeds. Our current understanding tells us that dogs are born with certain genetic predisposition to developing hip dysplasia, and the environment in which they grow adds on top of that predisposition. A common misconception surrounding the genetic predisposition to hip dysplasia is related to its estimates of the heritability. These estimates differ between breeds and studies, as we've said before, and ranging between 10 and 70%. A very generalized ballpark figure that you'll hear mentioned frequently is that the heritability of hip dysplasia is around 35%. Now, you may have heard some people saying this percentage in the context of explaining a hip score of a specific dog. Only 35% of your dog's score is explained by genetics. Well, as you should know by now, this is incorrect. The 35% describes the proportion of the variation in the breed, not in the individual score. The only way we can actually say whether a dog's hip score is driven primarily by genetics or environment is if we have a highly accurate EBV of the dog and we compare that to its phenotype. Of course, there has been a whole number of studies which have tried to identify which genes are responsible for hip dysplasia. An obvious candidate would be the genes related to joint conformation and laxity. But there have been other genes that were picked up, for example, genes involved in maturity rates, bone mass and density, muscle development, and many, many others. So it's going to take some time before we know exactly which genes are responsible. Equally, loads of research has been done on the environmental impacts on the development of hip dysplasia. I'm not going to go into this in detail as I'm not a vet, but there are some factors that we have all heard, such as an obvious age, sex, body weight, and so on. These are the effects that most of you would list if we asked about the environmental impacts on the hip dysplasia. But when we look at this from the data science point of view, there are other sources of variation between hip dysplasia records. So, for example, there will be difference between the grading methods. We will get different sensitivity from a CT scan than from an ultrasound. There will be obvious differences between grading scales. Are we assigning a label such as excellent, good, moderate, or maybe are we assigning a numerical score? Finally, who's doing the grading? Some graders may be more strict than others. So all these things will add to the environmental or error variation. So we can limit the impact of the factors on the right-hand side if we standardize how we collect the data. If all hip scores are measured using the exact same method and on the same scale, we can completely get rid of those nuisance factors. If we have multiple graders assessing each dog, we might be able to minimize the personal biases. So all this can be done if we standardize our scheme. And such schemes can simultaneously collect other information such as the age of the dog, sex of the dog, and so on. So I will concentrate on a scheme like this, a standardized scheme that has been developed by the British Veterinary Association in partnership with the Kennel Club. The scheme is actually the longest running health scheme for dogs. It was founded in 1965. And within that scheme, we have now graded more than 250,000 dogs across 180 breeds. Under this scheme, any dog over the age of 1 can be graded. A radiograph of that dog is collected by the GP vet, and the X-ray is then sent to the DVA, where it is assessed by a panel of specialists. Those specialists grade 9 characteristics in each hip joint, and the total score is calculated as a sum of the 2 hip scores. The ideal perfect hips would be given a score of 0, whereas the worst possible score is that of 106. Of course, breeders have been using hip scores in phenotypic selection in the past, and we know that we are seeing some progress. So on these 2 plots, we see the comparison between the hip scores for Newfoundlands. On the left side, we have Newfoundlands that were born between 1990 and 1992. And on the right, we have those that were born between 2012 and 2014. So we can clearly see that we have decreased the number of dogs with very bad hips, so towards the right hand of the plot. And we have increased the number of dogs with good, low-scoring hips. But we are seeing some differences between breeds. The progress is better in some breeds than in others. That success or response to selection depends on the heritability of the trait and also how strict we are with the selection and by how far our chosen animals are better than the rest of the breed. These last 2 parameters are fully dependent on the breeder's decision. So depending on the breeder's priorities, these may be cranked up or they could be relaxed. We generally can't do too much about the heritability, or at least it's not very easy. So if all breeds were equally prioritizing selection against hip dysplasia, we would see that breeds with higher heritability would be achieving faster progress than breeds with lower heritability. By comparing the EBV trends in breeds with different heritabilities, we see that unfortunately it looks like progress in different breeds is driven more by the priorities of breeders than the difference in heritabilities. So the 2 plots that we see at the bottom show the EBV trends in 2 breeds. The first breed has a relatively low heritability of 30%, and yet we are seeing a nice and steady decrease in EBVs. In the second breed, even though the heritability is considerably higher at 44%, EBVs are not only not decreasing, they are actually getting slightly worse. We are, however, hoping that the situation is going to change soon, both through improved education, but also by improving the accuracy with which breeders can select against hip dysplasia. I'm very proud to say that the Kennel Club in the United Kingdom has been offering EBVs to dog breeders since 2014. We currently offer hip EBVs for 30 breeds, and for 8 of those breeds, we also offer EBVs for elbow dysplasia. We are going to extend the number of breeds for which we offer those EBVs, and also we are planning on offering EBVs for other traits in the future. The EBVs and their estimated accuracy are displayed graphically in our health test results finder online tool. The EBVs of each dog are presented in reference to the mean of EBVs over the last 10 years. The EBVs are updated quarterly and they are freely accessible to anyone. You can check the health results of any dog on our website as long as you know that dog's name or his KC registration number. So how does that look in practice? Let's have a look at 2 dogs, again, Fido and Rover, not very original with the names. Both of those dogs have EBVs with high confidence values. So this is the first thing I look at when I look at the EBVs. Both of these dogs were actually popular sires. We had a lot of information coming from their offspring, and so that boosted the confidence with which our EBVs are estimated. Next thing that we're looking at is the score of those dogs. Both of them actually looking excellent. Rover is slightly worse than Fido, but still both of them are below the breed mean and median score. And yet, one of them has a very good EBV of -47, while the other has an EBV of 52, showing that genetically there was actually a massive difference between those 2 dogs. Sadly, Rover produced quite a few high-scoring dogs with severe hip dysplasia, whereas Fido produced a lot of offspring with excellent hips. So by looking at the EBVs, I'm able to select the dog that is more likely to pass good genetics to their offspring. So how do we get those EBVs? Well, exactly as we would do for other traits in other species. We use a statistical model which combines the complete electronic pedigree of a breed that we hold at the Kennel Club with all the hip scores that were generated through the BVA-KC scheme for that breed. This statistical model takes into account some other factors, such as the age of the dog at scoring, sex of the dog, litter effects, and so on. This allows us to more accurately dissect the scores into the genetics and the environment. So let's have a look at how these effects are used in the calculation. We have produced a litter of puppies based on the EBVs of their parents, which are calculated with all the available information. We can estimate the breeding value in the puppies from half the EBV of the sire and half EBV of the dam, because we know that each parent passes 50% of their genes to their offspring. As we don't know which puppy got which combination of the genes, all of them will have the same EBV to start with. For this example, let's say that it is a negative -7. To differentiate between those puppies, we need information about their own scores or the scores of their offspring. So fast forward a year, our puppies have grown up. A breeder kept 2 bitches and scored them at the age of 14 months. Their hip score is nearly perfect, so their EBV has dropped further from -7 they had at birth to -15. Another bitch from that litter was also scored, and unfortunately her score wasn't so great as it was 16. So her EBV changes accordingly. It is now actually worse than the breed mean, so it has a positive sign. After a few years, another bitch from that litter is scored and gets the same score of 2, but she was nearly 4 years old at the time of scoring. So normally we would expect older dogs to have worse scores. So for a 4-year-old dog to have a nearly perfect hip score, her genetic background must be pretty good. So her EBV is considerably better than that of her siblings. At the same time, a male dog from that same litter was also tested and received the same score of 2. His EBV is also going to be great because of his age at the time of scoring, but it is going to be even better because he is a male. So in most breeds, males are expected to have slightly worse scores. So for a male at nearly 4 years of age to have a nearly perfect score, he must have inherited the best combo of the genes in the bunch. This, of course, is a very simplified example, so please don't come chasing me about the numbers. In practice, the scores of the siblings would contribute to the EBVs of their litter mates, as well as the EBVs of their parents and other relatives. We haven't even touched the confidence at all. So, but hopefully it illustrates how EBVs take the information obtained from the relatives with the information we have obtained about the dogs themselves. I would like to come back to the accuracy for a moment. So as we've discussed before, EBV on its own is not informative. First, we need to be sure that the confidence score of that EBV is actually sufficient. So this histogram shows the accuracy of dogs born between 2012 and 2020. As you can see, EBVs are providing more information than the HIP score alone to 21% of the dogs born in that time. Ideally, we would like to improve those accuracies, but of course that means we need to test more dogs. Another factor which will impact on how effective our selection is going to be is unfortunately underreporting of bad scores. And this sadly affects all schemes where testing and submission is not obligatory. It affects equally people that are using EBVs and people that are just looking at the scores of the sire and dam. So after taking the X-ray, the GP vet sometimes will inform the owner what they think of the hips of the dog. In some cases, if the hips are looking bad, owners decide not to send the X-rays for official scoring. In fact, it is estimated that normal hips are 8 times more likely to be submitted than bad hips. But this introduces bias in the data and has a knock-on effect on how accurately we determine the genetic merit of dogs in our breed, whichever method we choose. So it is really important for all of us to normalize reporting of bad scores. We need that information. Looking into the future, unfortunately, there are no, and most likely there won't be any tools that will completely eradicate the need for testing. So we need to accept that we will be testing dogs for as long as we have to until we make sure that no dog is genetically predisposed to the condition. So EBVs and other tools that may be developed in the future may make that selection easier by honing in on the genetics, but their value actually depends on the availability of the phenotypes, in this case, HIP scores. So of course, there are multiple benefits to testing your dogs. This list is based on HIP scoring, but the same can be applied to any health scheme where a complex disease is measured and recorded. First of all, it provides you with information about your own dog that you need to ensure that he has the best life possible. If there are some subclinical cases, HIP score will let you know so that you can provide some preventative treatments, some supplements, physiotherapy. Secondly, it provides you with the most basic information on whether you should even consider breeding from your dog. Having this knowledge, you can plan your breeding program so that your line becomes genetically less and less predisposed to hip dysplasia. It also has the added benefit of showing the world that you are committed to improving health in your line. So these benefits are fairly obvious, and they have been driving the phenotypic selection against hip dysplasia in the last few decades. But there is now one more argument for testing your dogs. By testing your dog, of course, you improve the accuracy of EBV for all dogs in your line, but also you are improving the accuracy of EBVs for all other relatives of this dog. So by testing your dog, you are helping other breeders make well-informed decisions. By testing your dog, you are contributing to the betterment of the whole breed. So I hope that this talk helps clear up some misunderstandings around selection for or against complex traits. By no means, it's not an easy task, and it's going to take generations, but this shouldn't stop us. We know from other species that if we really try, we can achieve amazing progress. However, it will depend on how committed we are to testing and how open we are going to be about our results. We have discussed how EBVs could be used to help us. Their value lies in capturing the genetic merit of the animal after we remove the effects of the environment. But we do need records, health records, to make sure that the EBVs are actually informative. I'm sure that I'm preaching to the converted here, but I hope that this talk provided you with some arguments that you will be able to use when discussing importance of health testing and maybe the use of tools such as estimated breeding values with your less convinced breeder friends. Because to fix complex diseases, we really need to work together. Thank you.
Thank you so much, Dr. Ilska, for that fascinating presentation. As a breeder, seeing the emerging science around EBVs, for some of us that aren't associated with things like guide dog schools that have been using them for quite a while, it's just very rewarding to see that this is a tool that we can begin using ourselves in smaller scale breeding programs. We do have some questions to go through. We don't have a ton of time, but I would encourage our audience members, please feel free to submit your questions into the Q&A box on the screen, and we'll try and get to as many as we can in the time that we've got right now. So the first question out here is about this is particularly looking at HIP EBVs and the submission being voluntary. So how do you account for selection bias and breeders and owners either skipping the test entirely or not submitting the information for the calculation? Doesn't that make it meaningless for everyone else, or how is that accounted for?
Absolutely, it's a great question, and it's something that we are all suffering from. So when we think about the EBVs in comparison to HIP scores, the strength of the EBVs is that we are actually sourcing the information not only from the dog score, but from all the relatives. So even if a particular breeder decides that, well, I don't really want to score my dogs, we are going to get information from their cousins. From the cousins of his dogs. So we are going to get more information from the rest of the population that will feed into our selection decisions. It is absolutely a problem, and there is no denying that. We do try to target both breeders and vets as well in education programs to actually explain to them that, well, those bad scores are the ones that we really, really need. EBVs will be only as good as the data that we have, but I'm quite happy to say that we are seeing a growing awareness of the importance of health testing. So I think that it's becoming a norm, and people who actually don't test their dogs become, well, sort of targeted by their colleagues, other breeders. Thank you.
Great. Yeah. I mean, not that we want anybody to be a target, but yes, the growing acceptance and what I see as a breeder certainly is puppy buyers are becoming more informed and asking questions about that, where they might not have done that so many years ago.
Absolutely. Absolutely. So I apologize. I shouldn't have used the word target. This is actually the reason why we are not making those tests obligatory currently. We are recommending them for breeders that want to follow the best standards. However, we do believe that we actually need to educate everyone, and we can achieve a greater success through education rather than well, removing people.
Absolutely. There's a little bit of a pivot, this question, and it touches on where you were talking about with the complex inheritance. There's multiple genes involved and multiple options. So how do EBVs deal with the potential for some genes to be masking the expression of others?
Yeah, so it's another great question, and I think that in the future we are going to see a nice merge of the genomics and pedigree-based analysis, such as the statistical models that produce the EBVs. So let's say that we do know that a specific gene acts as a modifier, and then we have the rest of the genetic value of a dog. In that situation, we can actually we can include the genotype for that specific gene in our model. So it is, in a way, treated similarly to, for example, sex. We say that we know that there is an effect of that specific genotype for this specific gene. So get rid of that first, get rid of the effect of that gene, and then assess the rest of the genetic value of that dog. If we don't know the genotype, then, well, we can only do the best that we can, and that particular modifier is going to be included in the total value of the dog. So it will be incorporated in the overall EBV.
Excellent. The future is an exciting place with regards to dogs and genetics. Unfortunately, we're out of time, so there's a couple of extra questions. We can certainly get those over and try and get those answered for folks. Is there any place that people can follow you or your research, or might be able to reach out if they have additional questions?
Absolutely. So my email address is joanna.ilska@thekennelclub.org.uk. You can also contact us by writing an email to health@thekennelclub.org.uk. You can find that information on the Kennel Club's website, but I'm quite happy to pass that information to you as well, so it can be put somewhere in the notes of the meeting.
Excellent. Thank you so much, Dr. Ilska, for this fascinating information and helping us make a better future for dogs. Up next for our attendees, we do have a panel discussion on the science of canine wellness and longevity reimagined, and that's going to be moderated by Embark founder and CEO Ryan Boyko. And don't forget, there's a lot to explore beyond the actual presentations in the, go through the lobby with the Embark booth, the science lab, the press room, and the barking lot. So I will turn it over to you guys to head over to the next panel discussion. And once again, thank you so much for your time, Dr. Ilska.
Thank you so much for having me.